This is the greatest public health concern we have for our youth.
It's the most vulnerable time of their life.
These are dangerous drugs, and we know that to be the case.
Alcohol has become the #1 cause of accidents among adolescents. And it's not just the danger of drunk driving. It's also alcohol's role leading to misuse of other, more dangerous drugs, like prescription drugs.
Kids who start drinking at a young age are significantly more likely to use a prescription pain medication.
These highly addictive pills are easily accessible unless parents and communities take steps to remove them from family medicine cabinets. According to Dr. John Knight of Children's Hospital in Boston, prescription drugs can be deadly. One reason is that, like alcohol, prescription drug abuse can cause serious harm to adolescents' still developing brains.
We now know that the brain continues to develop into the mid to late 20s, and during that time, it's especially vulnerable to the effects of any drugs that it's exposed to. And the younger the age of onset of alcohol use or prescription drug use, the greater the effect on the developing brain.
What's more, studies show that teen substance abuse is a leading cause of depression and even schizophrenia later in life. And painkillers and other opioids are so addictive that, once hooked, kids sometimes turn to cheaper street drugs like heroin.
I have a 13-year-old son named Jordan, and he's a very well-rounded, good kid.
Parents like Medford's Nancy Campobasso worry that even though their kids are on the right track now, they could get sidetracked by a future bad decision. She's taking steps that will help her son Jordan avoid alcohol and other drugs.
I think the biggest challenge for parents right now is they don't have enough time to be with their children to educate them. How was your day at school?
Nancy tries to talk to Jordan every day, a practice she says leads to their openness with one another. Despite having a full-time job, she also provides strong guidance and checks to make sure her son is on track.
I do check up on his Facebook, his phone. I think it's very important to be involved in your child's life, starting more in elementary school. I know the big focus is let's get to the high school and focus on them, but by then we notice it's really too late. You know, even if you can take that 15 minutes in a car ride to shut your radio off and talk to them, that helps.
So what can parents do to prevent substance abuse?
Parents need to be role models, so they need to use alcohol responsibly in front of their kids. They need to talk about it in responsible ways. They need to process with them things like what they see on TV and what kids hear in music relative to substance use.
For prescription drugs, it's important to talk to grandparents because they tend to have a lot of prescription medications. The teens know this, and when they visit Grandma and Grandpa, they may be looking through the medicine cabinet.
One of the things that families and communities can do is really look at kind of sponsoring safe storage and disposal campaigns. And I know many of our communities have already started to do that.
Here's some tips that you can use.
One example is the Alston-Brighton Substance Abuse Task Force.
Thank you. Have a nice day.
Working with their pharmacy and local police, the task force holds a prescription drug take-back day, where residents can properly dispose of their unused or expired medications.
What we're trying to achieve is, education, certainly community awareness that the problem exists, certainly some strategies that we know are effective, like the Take Back Day, and also educating parents and actually all role models.
Not the least of which are the kids themselves, who help spread the word in school.
My friends think it's a good thing because, it helps influence them to know what's going on with drugs and why not to do them.
We so value the youth members of the task force because it's their voice that we listen to. They are the voice of the community, especially where teens are involved.
Across the state, there are other efforts aimed at preventing underage drinking and drug use. From giving guides to parents and doing shoulder taps in Chelsea, to ad checks in Dorchester, to sticker shock campaigns in Lynn.
Grab a beer and see if he'll ask you for an ID.
In Somerville, police and kids work together to ensure that outlets are not selling alcohol to anyone under 21.
I need ID to sell alcohol.
Just post it as your status.
At this workshop in Hingham, run by Students Against Destructive Decisions, kids are learning to model healthy behaviors and promote good decision making.
Here at the SAD meeting, we're learning the myths and facts of drinking and how it's okay to not drink. It's okay to say no.
Leave them on that table and run.
Julie Nussbaum is SAD's National Director of Prevention and the SAD Massachusetts Coordinator.
It's a multifaceted program that engages youth through a social marketing campaign and parents through concrete action steps and tools. There's a website, and the most intensive part of the program is helping communities create local policy task forces. It's a way to strengthen the policies that we know govern behavior.
The kids here are using social media to educate their peers. In school and online, they are promoting lifestyle choices that don't involve drugs or alcohol. Why?
To show that there are a lot of high schoolers that choose to say no to alcohol and drugs, and that it's really easy to make good decisions.
They've developed a website, buzzcheck.com, that features quizzes and facts to show youth how many of their peers are making healthier decisions.
We're going to show one BuzzCheck video to get the kids kind of curious about it. And there's little BuzzCheck cards, which when kids walk into school, we're going to hand out the BuzzCheck cards and pencils to kind of get kids wondering, like, what's going on.
Monday night, we're doing the Facebook update. Okay.
At 7 o'clock on Monday night, we're all going to make our Facebook status as a link to BuzzCheck.
Okay, everybody's really going to do this, yeah? Yeah, okay.
Hingham's police chief, Mike Pereno, recognizes that keeping kids safe from drugs and alcohol requires a community-wide effort.
What better way to get to the parents than to the schools? Because, you know, every kid goes to school, so we work with the PTOs and having parent nights, and where we'll have police officers at those parents' nights to answer any questions they might have and get our message out.
You don't have to be drinking alcohol, you don't have to take drugs, and you can still have a fun time.
We want to increase the probability that kids are going to be making good choices and not making choices that are really going to have significant damage both in the short term and in the long term.
Adults and youth working together to find a solution.